Have you ever lost your grip just because your hands went numb? Or did you wake up early in the morning because you feel this electric type of sensation in your lower leg and in your foot? You're not alone. That's why in this video, I will teach you the most important home remedies that you need to focus on to help alleviate your symptoms, because nerve pain, it can actually impact the way you do things, your work, and even your sleep. Stay with me until the end because I will share with you silent mistakes that are actually worsening your symptoms. Hi, this is again Doc Sherry, Doctor of Physical Therapy. Welcome to my channel. The most common cause of hand numbness is due to the compression of the median nerve at the level of the wrist joint. And the one probable reason for numbness in the lower leg and in the foot is due to sciatica, wherein the sciatic nerve is impinged at the level of your lower lumbar spine. And although surgery is one treatment option for both conditions, conservative management actually works if you do it right. So let's begin. With hand numbness, simple closing and opening of your fingers. You can do this at home or in the office. Do it 10 to 15 times. This is a simple exercise that can actually lessen the symptoms simply because it improves blood circulation in your hand, which is very much needed for nerve repair to take place. Do this early in the morning after you wake up or before going to sleep. This is a very simple technique that you can incorporate in your daily lifestyle that can make a big impact with your neuropathy management. If you have been diagnosed with carpal tunnel syndrome, massage is not a contraindication for you. Feel free to get any lotion or any oil, and using your thumb, you apply circular firm motion in the palmar surface of your hand. The purpose for this is to loosen tight palmar fascia, which can actually worsen neuropathy symptoms. Now this time, we are going to focus on the wrist joint. At the same time, we are going to stretch the median nerve. To do this, we simply do clockwise and counterclockwise motion at the wrist joint. So you can do these 10 times. Then after which, we are going to stretch the median nerve by assuming this position. You can feel the stretch here in your wrist joint. Try to maintain this position for 15 seconds. Relax, and then you repeat it 3 times. This can really help patients improve their symptoms conservatively. Later, I will also share with you the type of splint that you can use at night, because mind you, neuropathy symptoms is actually worse at night or early in the morning. Now, let's talk about sciatica. The most important home remedy that will help improve your symptoms is for you to understand that not all back exercises are actually good for you. This is very significant because the right exercise can actually widen the space within your vertebral canal, releasing the sciatic nerve. If you have been diagnosed with sciatica and you can see in your X-ray or MRI result, diagnoses like lumbar spondylosis, osteoarthritic changes, spur formation, and even stenosis due to arthritis, and even spondylolisthesis. Do this exercise at home. Unilateral knee to chest. To do this, you can simply lie flat on your back. If you can tolerate, do not use any pillow. Then bring your knee to your chest. Hold this position for 7 seconds. Let go, relax, and then repeat it 10 times. And do it on your opposite leg as well. The next position that will help you is bilateral knee to chest. To do this, simply lie on your back, then bring both your knees to your chest. Hold this position for 7 seconds, let go, relax, and then repeat it 10 times. Do this exercise consistently, it can greatly impact or lessen your symptoms. If you haven't done your X-ray or MRI result yet, please try to observe. If you notice improvement of your symptoms, every time you bend forward like this, these 2 exercises that I've mentioned a while ago can also help you. Do these exercises 4 to 5 times a week. It can greatly decrease your symptoms. if the cause of sciatica is due to disc herniation. If you can see in your MRI result, terms like disc herniation, disc bulge, disc prolapse, these two exercises can help you. Prone on elbows. Simply lie on your tummy and then try to elevate your upper body using your elbows. You maintain this position for 2 minutes. This shouldn't elicit pain. Stop if there is pain. But if there's no pain, next time you progress your way up and work towards 3 to 4 minutes. The second position that will help you manage sciatica caused by disc herniation at home is prone with your elbows extended. This time, you assume this position for 2 minutes and then work your way up to 3 to 4 minutes. This is a natural technique that will help you manage sciatica conservatively at home. For hand numbness, using wrist splints can help you. This will help you so you sleep better at night because neuropathy symptoms is worst early in the morning or during your sleep. With sciatica, a firm mattress can really help you because it can stabilize your spine while you sleep. That is the reason why orthopedic mattresses can really help for those who have been diagnosed with orthopedic spinal conditions. If you are working in an office, a chair with a proper lumbar support is very important for you. These are the silent mistakes that you need to avoid. If you experience numbness in your hands, please avoid always flexing your wrist joint like this. Try to observe the activities that will exacerbate your symptoms and try not to do it for the moment to allow healing. Also, check the mouse that you are using in the office. The correct mouse should also put your wrist in the neutral position. If you had been diagnosed with diabetes, also keep your blood sugar in check because elevated blood sugar can actually cause numbness on both hands. If you had been diagnosed with sciatica, try to avoid twisting your back. It can actually exacerbate your symptoms. Also, avoid the improper way of getting up from bed. If you want to know the proper way of getting out of bed that will actually not exacerbate spinal conditions, I will put it in the link below. For your foods and drinks to support nerve repair, prioritize the foods and drink in this video here. I will put the links in the description below. For the number 1 go-to vitamin that can help support nerve repair, we also have it in the video here. These are the most important home remedies that you need to focus on if you want to manage carpal tunnel syndrome and sciatica conservatively without surgery. These can greatly help you. If you want to know about the number 1 neuropathic pain medication that is prescribed for neuropathy and radiculopathy, we have a video here. You can check on it. Thank you very much for watching. I will see you on our next video.